Hey, welcome everybody. Thanks for watching our recording here. We're going to have a little conversation today about church in a post-COVID world. We know that we're kind of moving through this COVID crisis, continuing to move through this COVID crisis, and we're beginning to see a little bit of potentially a sliver of light at the end of the tunnel about things beginning to reopen, phased in, depending on your state and where you are. Different, there's different kind of dynamics around that. But either way, we've kind of settled into this virtual church world thing, and lots of people doing a great job at that and still learning. But now we got to start thinking about what's it going to look like when we're able to return to campus, when we're able to start having people back on campus. When should we do that? What should we be thinking of? And what's that really going to look like? So I just want to have a conversation around that today. And so we've got some guests here today that I want to welcome. So my guests are Danny Franks, Greg Atkinson, and Jason Young. So Danny Franks is the pastor of guest services at Summit Church in Durham, North Carolina. He's been there since 2003. Greg Atkinson is the founder of Worship Impressions and the First Impressions Conference. He's a best-selling author, a leadership coach and consultant, and a member of the Forbes Coaching Council. So welcome to Greg and Danny. Jason Young. Jason has worked with Life Church, North Point Ministries, Chick-fil-A, and many others, helping organizations grow their leaders, develop and deliver remarkable hospitality. So welcome to you, Jason, as well. Thank you guys for being here. And I'm your host, Greg Morris. I'm a senior generosity strategist at Generis. And it may feel like that today's topic has little to do with generosity. That's kind of my wheelhouse. But really, it has everything to do with generosity, because how we handle this is going to determine a lot about how generous our people are or continue to be. So we've got to handle this well, and we've got to think through it well, and be sure that we don't start back doing what we were doing without thinking through what it should look like and what should be different now. So I'll post the contact information for all the conversationalists and myself. I'll share that at the end of the recording, so that will be here for you. And so I just want to jump right in and kind of talk a little bit about and just ask these questions and let these guys answer them. So we've got a few questions here we want to cover. So first question is, if there's a phased-in reopening plan for churches, which it looks like is going to be the case, it's mandated by our state governments, should we jump back in phase one, or should we wait until later? So I'll just let you guys go. We'll start with you, Jason.
Well, let me set the stage for myself. I'm not a COVID-19 expert. In fact, I rolled off a church staff last fall. And so I know Danny, of the three of us, Danny is, on a church staff. And so mine is from an observation from the sidelines and, working with churches and companies. So if you're watching this and go, golly, there's a lot of COVID-19 experts out there ready for churches, I think the three of us would say, hey, we're listening, we're learning. We're just chiming in and having a conversation today. So I just want to say that to start. This is a hard question because I don't know that I actually have a helpful answer. I think states, and we were talking before we got online, Greg was mentioning, even down to communities are making decisions as to what they should do. So should they jump back in during phase one or wait until later? I don't know. I'm seeing churches and even companies, organizations have their own re-entry plan or their own phases in light of what the state government, which is probably a pretty smart approach. What I think we should caution churches to do is not to compare yourself with the church down the street and feel this rush to do it because they're doing it. I think you have to make decisions that are safe for your people, safe for the community, sensible to what you can staff, and sustainable. Can you do it for this phase and this number of months, and so forth and so on. So I think churches should consider the reopening plan in light, with the backdrop being the state's reopening plan, and just remove the pressure of nobody's going to get it just right. I don't even know what just right looks like. I don't know that anybody does. So I think it's trying to make sense of what you have the options to do, when you can do it, the people to do it, and then what does it look like as you do it in multiple phases. So just those are my observations at this point.
Okay, good. Thank you. Danny, you want to take a run at that one?
Yeah, I mean, I hate to start with a disagreement, but Jason, I don't know what you're talking about coronavirus experts. I watched a lot of ER back in the 90s. I feel like I know as much as anybody possibly could about it. No, I think you're absolutely right. I think when we are rushing headlong into let's be the first kid on the block to reopen, that's not always a sign of loving our neighbors well. There are a lot of people that still have a ton of fear. There's a lot of us as leaders who we're not experts, and we might really want to make the right decision for the spiritual well-being of our people and put the physical well-being of our people on the back burner. And so it's just really important that we wait. I know for us, we will not be physically gathering together again during phase 1, probably not even in phase 2. Because we are we want to have that phrase we've heard so many times over the last couple of months, an abundance of caution, to make sure that we're protecting our staff and our volunteers and our congregation and our community. We want to make sure that we're super careful about that.
Cool. All right. Thank you. Thanks, Danny. Greg?
Yeah, honored to be a part of this. You were talking about your expertise being generosity earlier, and I have said for years that generosity and hospitality are two sides of the same coin. I do a lot of writing and consulting with hospitality, but right there in the mix of my heart and my makeup and my passion is generosity, and I think they do play well together, and are both thoroughly biblical concepts and themes. And so when I think of hospitality and I think of loving our neighbor, sometimes that means just the simple word patience. Patience. Just because you can open doesn't mean you should. We were talking before we hit record, and us three First Impressions guys, we're all based in the Southeast, and so our states are opening quicker than a lot of states around the country. And so Jason being in Georgia loosened very quickly, and then I'm in South Carolina. I'm in the Charlotte metro, but I'm right over the line in South Carolina, and South Carolina has relaxed everything this week. And so I was saying before we went on air, if I wanted to, I could go to a restaurant right now and sit down in a booth and order and eat in a restaurant, but I'm not going to do that. I've already been sick once. I've already had this once. I don't want it again. And so I'm trying to use caution and to use patience. And so just because you can doesn't mean you should. And so everybody's context is going to be different from state to state, from city to city, from community to community. And then even within your own congregation, you're going to have those who are saying, Pastor, let's get back and let's meet. And they're going to have those who say, Pastor, I'm not coming. And so one of the things that I have been talking about for weeks now, I wrote a blog at my blog, gregatkinson.com, that actually went viral, talking about top questions you should ask your congregation before you reopen. And I talked about the idea of bringing back the old congregational survey, to poll your people, to survey your people, to ask, do they even want to meet? Would they even come back? If you were to hold services, would they even attend? And so I think right now, the best thing that we as leaders can do, and those of us that are advising leaders and coaching leaders, is just to pray for wisdom and discernment, and to practice patience. Just because you can doesn't mean you should.
A good word. Yeah, I like that. I like the idea of the survey too. I think that's very important, because I think we may assume some things that may or may not be true. So I think finding out what people are really thinking is important. So thank you for that. So let's jump on to another question here. Second question. So as we begin to think about a return to our facilities, what are 2 or 3 of the top issues that we really must consider as it relates specifically to our volunteers and our first impression efforts? So we'll start with you, Danny.
Sorry, I didn't have my finger on the trigger button. I think obviously it goes back to safety and cleanliness first. We're going to have a plan, and with that, I mean the things that automatically come after that are how many people are we going to allow to have in at a time. if social distancing rules are still in order. How many services do we have to add in order to be able to fit people in? Is there going to be a cutoff where we would say, hey, it doesn't look like our church if we try to host a physical worship gathering with less than this number of people? For a venue that will normally hold 1,000 people, do we really want to open that when only 100 at a time could get in, or 50 at a time, or whatever the state might mandate? So one of the things that we're thinking, or some of the things that we're thinking through, are just obviously the big ones that everyone is entry and exit plans, safety for our volunteers. Are we going to require them to wear masks, gloves? Are we going to give volunteers the option to show up or not show up? Do we have a plan for what happens if the majority of our volunteers say, I'm not comfortable yet serving? The social distancing practices within the auditorium itself. Do we seat families together, leaving large gaps? Do we kind of adapt a pod system where we're separating people? How do we make our campus as touch-free as possible, where nobody touches a door handle? That's always been one of our unofficial values anyway, from a hospitality standpoint, but now it's really serious that we have people or have our campus set up that way. And then just, even the amount of time that our services might go on, the longer that a group of people are in with one another, and the less time that there is in between services to sanitize the auditorium, the higher risk that there is that we're going to communicate some sort of a disease back out into the public.
Yeah, good stuff. Yeah, thank you, Greg.
Yeah, this is where that praying for wisdom and discernment and patience comes in, because pastors, your congregation and your community are looking to you for leadership, and what you model and what you practice speaks volumes. And so I have a weekend worship and guest services Facebook group with about 14,000 people in it, and I'm watching all these conversations happen. So I have a pretty good pulse on a lot that's happening across the nation with different opinions and different values, and different people that are rushing back, and some that are saying we're not even going back in 2020. It'll be 2021 before we go back, and some that are talking about July and September, and some that would only go back to a drive-in. But one of the things that has to be addressed and is more of a heart and a mindset and a posture of service and hospitality, because there were two very large churches that opened up this past weekend. We would call them giga churches, and they had pictures of their parking team and their greeters wearing masks and holding signs and welcoming people. And so I posted that in my Facebook group and said, here's some thoughts of what it may look like when you open back up. And somebody commented and said, if I have to wear a mask, I'm not going back. And I said, well, then you're probably not ready, because we are in a situation where we have to practice best practices. And if our state and local and government officials are saying it's best to wear a mask, and you're not willing to wear a mask, then you shouldn't open. And so looking at what is best for our people and how do we model for our people, as somebody that works with churches around the country in the arena of first impressions and hospitality, I always address the heart and the attitude. And I think of conversations I've had over the years with pastors that say, I can't get my parking team to stop bunching up. They're always together, bunched up in the parking lot, chatting and talking and ignoring the cars, and they won't spread out like I've asked them to. Or my ushers don't usher. They don't actually seat people. They just stand there and pass out bulletins. And I'm thinking, we're wanting to go back to these same people, the same greeters that say, I'm not wearing a t-shirt. I'm going to wear a suit and tie. I'm not going to wear the greeter t-shirt like everybody else on the team. We want to go back to these same people who bucked our rules and huddled up in the parking lot and didn't seat people and didn't wear the t-shirt that was uniform that everybody on the team was supposed to wear. And we're supposed to carry out mandated health guidelines by the CDC with these same volunteers, this is going to be a hard thing. And so in the article where I talked about doing a survey, I also talk about pastors, before you ever gather together, before you open the doors back up, you need to have a leadership team meeting. You need to get together with your leaders and your volunteers, and you need to walk through what are these guidelines. Don't wing it on a Sunday morning. What is it going to look like? Where are we going to seat people? How are we going to constrict seating? How are we going to stay at 25% occupancy if that's the recommendation? Or if it's no more than 50 people, and like Danny said, we have an auditorium that seats 1,000. Where are we going to put them? How are we going to keep them separate? How are we going to make people feel comfortable and safe and at home and at peace? And so you've got to meet with your leaders. You've got to talk with your team. You've got to talk to your volunteers and say, is everybody on board? Are we all wearing masks? Are we gonna not reach out and shake somebody's hand? Are we gonna help people feel comfortable? So big time for leaders to step up. Wisdom, patience, and discernment. Big opportunity for leaders.
Good. Thank you. Jason?
Yeah. I think if you as a church staff leader, or maybe a senior pastor, you're trying to figure it out, here's the good news. I've been kind of tracking along with Disney World, watching them open their Shanghai location and how their cast members, or AKA employees, are wearing masks, and even on the parade route, how they're creating these boxes that you have to stay in, and there's separation. And, so they're trying to figure it out. So if you're trying to figure it out, you're in good company, because even Disney is trying to figure it out. Many people are trying to figure it out. So you're not alone in that. And the challenge is, what decisions should one make? What pressure should I feel as a church team leader that I should be making? And it probably could feel overwhelming, because there's a lot of decisions. And I mean, I don't even know what all of them would be. But in kind of thinking this through, I think maybe some things to just chew on is, expect fewer attendees, and that means volunteers too. And that's okay. But in so doing, adjust expectations, but work really hard not to downgrade the experience. So if you're going to have to downgrade the experience, the live experience, significantly, it may not be time to open, right? And as you think about, volunteers, how many are coming back? When are they coming back? Have you done a FAQ or expectations for them? So the Horst Schultz, he said this the other day, the companies that win in this time period, in this season, are the ones that care the most and the ones that communicate the most. And so this is a great opportunity for you to care the most and to communicate the most to your volunteers, because that feels, really, really, you feel seen and cared for. Don't get mad if your volunteers don't come back as quickly as you think they should. And they'll know how you feel by the communication and the vibe. So just be aware of that. And you may not even be thinking or feeling that, but it could subconsciously, come through. I jotted some notes down, like no hugs, no handshakes, no fist bumps. I know a lot of you are huggers. Don't be, in fact, I saw this mom and daughter created this plastic thing on Mother's Day that they wanted to hug, but they had to get in this plastic thing and come at each other. It's it was super weird. It's super weird. Don't do it. It's okay. Actually, people can still feel seen, not shaking their hand, not hugging them, and not doing a fist bump. Think about, how do you do offering? Digital only, drop off only, not passing plates and buckets. Again, all those hands touching it. Think about communion. Some of you do communion regularly. Do you not do it? Do you phase it in later? Do you do the pre-packaged little Lunchable, communion? If you have food and beverage service, maybe you should wait. Again, all of these are opportunities that are related to the experience that require volunteers to execute them. And so as you think about everything you're going to offer, think about the people that are actually going to do the offering, not the money, but offering these services to guests and, other regular attendees. And then, volunteers, wearing masks. And again, you're thinking about guests, and then you're thinking about your volunteers. And those are two really powerful experiences. But the volunteer experience, that's the one that delivers it to the guest. And so it's an opportunity just to, prioritize, allocate doors. You have to think of things through. And you know what? I think churches are going to really feel challenged. We don't want to offend anybody, so we'll just do everything. Well, I mean, I'll go to big box retail stores and only one door is open. I get it. Or, I went to a home improvement store the other day. One door was open. Okay, I get it. It's just, they're trying to look out for us. And so as you think about that, just use great wisdom for your volunteers and let them feel that you are including them in the process, caring for them in the process, and that they also have grace given from you to them, just as you want them to give it to those that regularly attend or to guests for the very first time.
Yeah, good word.
Greg, I echo everything that Jason was saying. He was talking about volunteers wearing masks. One of the questions that a lot of people, and maybe isn't on their radar, that I said on my blog about having a congregational survey, is to ask your people, do you expect us to provide a mask for you? And so when you gather back together, besides having one for all of your team, is your congregation of 200 or 500 or 2,000, are they expected to be handed a mask when they walk up or get out of their car? Or are they supposed to come with their own mask? And so just thinking through all of this stuff so that people feel safe.
Yeah, great point. And I think another thing, a question I've been getting a lot is about the no-touch thermometers. Who, obviously I know that I've had several conversations with family ministry folks, and they're certainly with kids, they're wanting to be checking temperatures and things when that starts back. But at what level are we scanning people's foreheads, with non-touch thermometers? Is that a thing? Is that going to be something we do or not do? And that's just something to think about. Some may not, but I think it's worth thinking about. So thank you. Those are good points. Let's jump on to another question here. So what are some of the larger or kind of the more corporate issues that we need to consider as we move back toward on-campus gatherings? Things like, disinfecting, social distancing, restroom care, things like that. Are there any just kind of big ones that jump out, things that might not be directly related to volunteers or first impressions, but things that, hey, did you think about, the fact that maybe your service times can't be as close together because we got to disinfect everything between services, things like that. So we'll start with you, Greg.
Yeah, I was doing a podcast last week. I did 2 podcasts. One was on children's ministry, and that's a big deal. When do we open children's ministry? And in most churches, almost every church, I don't think I've heard of a single church that has reopened that started with kids ministry. They're all just doing a family service, and that's wise. But on another one, I was talking about this very thing of what are the big buckets that we've got to touch on. And Jason mentioned, like not passing an offering plate, and how do you do communion, and Danny referenced sanitizing and disinfecting, and I mentioned this very concept of your service times are probably going to have to be spread out further apart. And so if you have done 9:30 and 11, you're going to have to do 9 and 11 or 9:30 and 11:30. But there has to be a time after each individual service to come in and sanitize and disinfect and wipe down, allow it to be wet, allow it to air out and to dry naturally on its own. And so, and what's unique about this is, like Danny kind of alluded to earlier, you are already having to do more services than normal because of a capacity issue. And so you can't hold as many people in a service as you used to. So now you've gone from maybe 1 service to 2 or 2 to 4, but then you have to take those service times and wipe everything down, every surface, every pew, every chair, everything's got to be wiped down according to CDC guidelines and the CDC Church Task Force. I read a great document that they put out. So your service times are going to have to be bumped out, and all of that has to be taken into account. And so I've seen people sharing links to giving boxes that they're going to use and like mount in the lobby where people can drop off an offering. And obviously this is a great time to just keep pushing online giving and digital giving and text to give and solutions like that. But thinking through these big issues of, okay, if we can have 25 to 50 people in the building, how many services does that mean for us? And if we need 30 minutes to an hour to turn everything around and clean it again. And so all that to say, you can't do like in the old days of we clean the church and prep it and get ready on a Saturday for a Sunday services, and at the end of all the services we clean again. It has to be in between each and every service, so it's a lot to consider.
Yeah, it really is. Jason?
Yeah, I mean, some of the things we've already mentioned, I think the basics would be like, just to reiterate, the social distancing, maybe you do offer face masks, maybe hand sanitizer, and I think it's 60% minimum alcohol are available throughout where people walk in preferably touchless machines. I think as silly as these examples I'm about to give are, they're helpful, but make sure soap dispensers in the bathrooms always have soap in them. Make sure paper towels are available to dry hands. If you have a bathroom door, people have to leave and normally they would grab it. Make sure there's a trash can there so people take a paper towel, they could touch the handle, or if your bathroom's set up the correct way, can it remain open? That's an option. Sometimes people, you could do they have these little elbow or foot things at the bottom of the door. Your foot can, open the door. Like thinking through all those little things. And the more you can disinfect, the better it's going to be. I think it is. Don't underestimate how helpful that is, and choosing when to do that, who does it, how do you do it, how do you do it well, be prepared with a plan, and also how to explain what you're doing. I did think about the temps at the door. It is something to consider. I'm not going to say do it or don't do it, but it's something to consider. Could feel really weird. It's another one of those things. It's weird, but the question is it necessary? And I think instead of making a decision to reopen your church or have a reentry plan or whatever terminology you want to use, there's probably more questions to ask. And if you're not at a certain point, it's probably not the right time. You just got to get there. And that's okay. That's okay. It's not an indictment on anybody. It's just a thing. And I think also setting expectations ahead of time for those that are coming. Not everybody's going to read it, but that could be helpful. Make sure you pay attention to high touch areas and disinfect those, really well. If you're in a church that I don't remember where I was, but I was somewhere and I kind of, wherever I was, and they came out and wiped behind me. And I thought, those people, they were on it. And I think the biggest thing is you've just got to be on it. Don't underestimate how important this is. And two more things, this was already mentioned, reduce the number of attendees so it's manageable. Again, you want to be the talk of the town for making wise decisions. You don't want to be the talk of the town for making poor decisions. Like I saw on an airline recently, that airline was too full and it got negative attention. You don't want the negative attention. You want attention because you've made wise decisions. And then the last thing that's kind of unrelated but related, that's a corporate issue, is maybe step one is to think about your staff, and maybe antibody testing would be helpful, because what I'm noticing, so I work with churches, but I'm also a chief customer officer for a healthcare technology company. And this is one of the most in-demand things we're doing for largest churches, corporations, restaurants, is doing the antibody testing, because people aren't sure, is that person ready to come back to work? That's a corporate decision. And so if you have the right information, you can make an informed decision to begin to parse staff out. They're ready to come back. You need to stay at home 2 more weeks. You need to go get a COVID-19 test, and you need to definitely stay away. So that is a corporate decision. I think that is important for your church to decide, are your staff even ready to come back? And how do you know that they are?
Yeah. Good. Thank you. Danny?
Yeah, just to piggyback off of something that Jason just said, I think making sure that we have spelled out what the plan is incredibly important, because we are going to soon see a lot of brand new positions for our staff and volunteer teams that we've never had to think about before. And these are going to be positions that are going to have to be managed and staffed any time that the building is open. So from an hour or two before the first service begins until 30 minutes to an hour after the last service ends. I can't remember if we brought up Trader Joe's in our last panel discussion, but man, I have been so impressed watching the way that they have responded to this. Our local store has just they've managed this like a machine. And one of the things that I've noticed is that there are employees serving in roles that 2.5 months ago were not in existence. There is one person who is responsible for managing the door. There is another person that's responsible for managing the line. He's wearing a big cardboard sign that says line monitor. There's somebody else that's responsible for sanitizing every single cart down to the square inch before a customer puts their hands on the cart. There's an employee that drapes a sanitizing wipe over the handle of that cart before you touch it. And then the person at the door gives you the go-ahead and says, "Sir, this is your cart. We've sanitized that for you. And if you'll go straight to that cart and make your way into the store." I think that's a great example of things like everyone has mentioned, to make sure that we have monitors at the doors to the restrooms to make sure we're not putting too many people in the restroom at once. If we're not providing some way to get out of the door without touching the door, then we need to provide a volunteer who's going to be wiping down that handle every single time somebody goes out of it. We need to make sure that we have people who are standing at the doors of the auditorium, not just there to greet people, but also they're just to monitor and make sure that we're not bunching too many people up, or somebody to give instructions on what's going to happen when you go in. So I think there's all kinds of opportunity, but it's the old adage, we can only expect what we inspect, and so we've got to be able to spell out very clearly what those expectations are. To go back to something Greg said, you think you're going to get a bunch of church people to turn on a dime and if all of a sudden follow the rules, well, you might as well stay in quarantine for a little bit longer, because that's not going to happen. But so we've got our work cut out for us in that.
Yeah. Great thoughts, guys. Thank you. So a couple more questions. Next question is, I know I'm hearing a lot of stuff just in conversations with neighbors and friends and other family members. I'm hearing a lot of things that people are concerned about. And I know, for instance, I think it was Sports Illustrated. I think that's correct. It did a survey, pretty big survey pool. And I think 78% of those surveyed said they would not attend a public sporting event until there was a vaccine available. So that screams concern. Hey, there's some concern out there. And so what are some of the things that, as you guys have conversations, not just with churches, but with friends, family, neighbors, things like that, what are some of the concerns you're hearing and things that that we might not even be thinking of that might really be a concern out there? So what are some of those? Jason, you want to start us out with that?
Yeah, I'll say this. I think some of the concerns are legitimate, and then some of them, I don't know, we can conjure up in our head, and that's not speaking down to how people are feeling. And I think we have to, we feel how we feel, but I think sometimes what feeds our feelings could be not the right voices or not the right origin of news or conversations. And so, some of it I get, and some of it it's interesting, especially working with this healthcare company. I'm privy to a lot of things that the average person wouldn't know. And, so that informs my own decisions. And if you're not, that informs your decision. So we just have to kind of filter things wisely. So I think some of the things that I'm hearing, some people, this sounds terrible, but I think for church staff, a lot of them in their mind is thinking about their opening. But what we forget in the community, most people in the community are not only thinking about that church, your church opening. That is not on their mind when they wake up and on their mind when they go to sleep. They're like, my kids at school, my kids on the all-star baseball team. When are we practicing? I've got dance, I've got voice, I've got work. There are an enormous amount of options and decision-making areas that are going on. And the church might not be as important as we think, being those that work in the local church. And so we have to kind of put our decision in the right perspective, that it's one of many decisions that people are making. And so with that is, getting the timing right. People are thinking, I want to get the timing right about what I'm going to, and getting my hair done or my nails, or going back to church. So there's a lot of timing. There's a lot of safety, concerns. Some are a little silly, and some are like, you should be. I think some people are wondering, what is the thought process? Danny, again, he referenced this a second ago, and we've kind of talked about it. Like, the more you communicate and let people into your process and thinking and the plan and how you're making decisions, the better you communicate. It just says you care. And so to expect people just to come back because you've opened back up is completely irrational. I think we have to invite people into, this is how we arrived at the decision. Here's what we, guarantee or promise you in this experience, et cetera, whatever it might be. And then, it's interesting. People are talking about, well, I'm going to wait till things open more, or I'm going to wait till more people do these things. And so part of it is a little bit of a kind of a social observation of what's my neighbor doing, or what's going on in my community. And then I'm going to kind of respond in like manner. I think some people, to your point, Greg, it may be a longer haul just to be sure. And then this is interesting. I hear a lot of people ask, well, who can really be trusted? And I think the danger is working hard to get people to trust you, because you're like, but seriously, you could trust me. You don't want, I get it. You don't want to trust some politicians or government or local, or whatever it is. You can trust me. I think you have to be careful, because sometimes the harder you work, it actually bites you in the end. So I think you just have to have a plan, think through it, communicate well. Remember other decisions people are making, so factor that in. Listen to people, move slowly, think about the timing, and I think be supportive of the decision that people are making. Not, that's silly, or you shouldn't, I think we just have to extend grace, and we may be extending grace for longer than we would like, but you know what? It is what it is.
Yeah, so true. Danny, you want to jump in on that one?
Yeah, I think if one of our primary jobs as church leaders is to be good shepherds, then we've got to be shepherding a lot of different kind of sheep. Those who are ready to come back, those who are scared to come back, those who are just waiting to see what the majority is going to do and follow them along the way. We have to be able to, as Jason said, we've got to communicate that clearly. And we've got to show a lot of understanding and compassion for those who aren't as ready to start back as we might be, or as we might think that our community is. So one of the things that we've talked about, and again, for us, a lot of this is just in the planning stages, but I think this will be one that'll definitely stick regardless, is for the foreseeable future, the next several months, if not the next year. We want to be able to provide some sort of a virtual alternative to any physical gathering. So if we're expecting a gathering of people, whether it's a weekend service for 1,000 people or a meeting of 12, we want to make sure that we are thinking about those people that are not quite ready to enter back into a small gathering or a large gathering with other people. So we want to provide Zoom opportunities or whatever it is for them to be able to participate virtually, even if they can't be there physically. And so I think that is one of the things we've just got to be very careful of as leaders, is that we're not in such a rush to get the doors open again, that we forget that there are those who have some maybe legitimate reasons or legitimate fears for not wanting to come back in. But on the flip side of that, I think that we're going to have to do a lot of work in the next year or so to kind of untie some knots that we have found ourselves in with people becoming so used to online worship experiences. And they're great, and churches have pulled out all of the stops to be creative and to make these work and to make them work really, really well and really, really effectively. Yes, I think there's a lot of good opportunities for us to engage in an online world that we haven't been doing, or a lot of churches haven't been doing up until now. But at the same time, that's not always going to be the best replacement for people being able to gather physically. And so while we do want to be respectful of concerns that they have, we also want to challenge people. Hey, don't forsake the assembling of yourselves together. If you're healthy and society is at a place where we really can come back together safely, don't let virtual church be your one and only option from this point forward.
Yeah, good. Thank you. Greg?
Yeah, I just want to echo a couple things that my friends Jason and Danny both said. You may not realize if you're watching this through Generis that Danny and Jason and myself do a lot with guest services and first impressions. We're not necessarily generosity or stewardship people, but we do first impressions and guest services and hospitality, and so that's kind of our bent. And I say that because we're people persons. I'm a high I on the DISC profile. We like to be around people. We like to gather together. And I echo everything Danny was saying, that, we there's nothing that can replace, like Jason mentioned earlier, that hug or that fist bump or that high five. But we just have to practice patience. And Jason said to listen. Now is the time for leaders to listen. It is not an appropriate time to hug and to fist bump, and probably for most churches to gather back together. I was watching a YouTube video that Larry Osborne from North Coast Church put out last week. He's the author of Sticky Church and Sticky Faith, and respected him for years and interviewed him for one of my books. And he was saying 3 reasons why churches shouldn't meet. And one of them was, if you're doing online better now than you could pull off physically, it's probably not time to switch. If you can't do a better in-person service, just stick with digital. And then he addressed the elephant in the room, the children's ministry, and how well are kids going to sit in a family service and pay attention in the auditorium with the adults and listen to a sermon from somebody even as gifted as J.D. Greer at the Summit Church. As a 5-year-old, going to be able to sit still and sit in the auditorium and listen to a sermon from the lead pastor of the church. And so I was reading something that Sean Lovejoy, who's a consultant coach and pastor I respect, he said to prepare internally and communicate externally. And it's been echoed throughout this panel, just over communicate. But there are some real reasons. And I think when you talked about concerns, which was the original question of this round, that's to consider the entire family. I have 3 kids, 3 teenagers, and 2 of my kids, my son in the middle and my youngest daughter, have weaker immune systems, and they've had health problems, and they have both been in the hospital. I was in the hospital recently, and back in the fall in November was at the Mayo Clinic in Minnesota. My immune system is not what it should be. My son and my daughter do not have an immune system that's strong enough to be around something so contagious, because when you read and when you watch the news and you read some articles, you find out how much more highly contagious coronavirus is than the flu. And so just practicing patience, listening, like Jason said, listening to your people, and then getting back to the very first thing Danny said, and that's we are shepherds, to shepherd people well. If people in your congregation, whether they're in that older demographic, which has been highlighted as vulnerable, people in their 60s and 70s and 80s, if they have weakened immune systems, if they have kids with chronic conditions, chronic illnesses, just to really take it easy and to gather feedback. That's why I'm a fan of the survey, to gather feedback and to touch base with all of your leaders and to make a decision, not as an individual, not as a dictator, but as a team. Are we as a team ready to do this? Are we ready to move forward? Are we all in agreement that we can do this with excellence? It's always been one of my core values when I help churches come up with a new members class and they work on their core values. I love the core value of excellence. Can we do this with excellence, or is our online experience still better than what we could pull off physically, like Larry Osborne mentioned? So it's a lot to think through. Great responsibility. I'm praying for pastors. This is such a huge weight of burden and responsibility. And so pastors, we're praying for you. We're here for you. But glad that Generis is holding webinars like this and being a resource to the Big C Church.
Thanks, Greg. Yeah. So one last question, and this is probably a quick one, but this is just from my own observations. I've been talking to church leaders all around the country, and originally they were all talking about a reopening, but so they're kind of calling this return to our campuses or return to our facilities a reopening. But I don't really like that terminology, because the truth is, the church really never closed. We're not reopening the church. We're kind of returning to campus. So I've heard you've all talked about the importance of communication. And even though even though this is a small thing, I'm just one of those believers that words create worlds. And instead of reopening, how do we say, hey, we're reopening the church? How do we communicate that when we are ready to relaunch? What's the language you guys feel like is most appropriate? Start with you, Greg.
Yeah, I totally agree with you. The church was never closed, so I wouldn't say reopen, but I watched a webinar kind of like this with Oksano. A friend of mine from Oksano, one of their lead navigators, reached out to me and said, hey, check out this webinar. And I watched it, and they're calling it re-entry. And so they're talking about a re-entry into your physical location, into your facility. But the church never closed. And we've been having online church and online small groups and missional gatherings. And so reopening can be a little confusing and a little misleading. Words do create worlds. That is, we have to be very careful how we communicate, the words we use. And so I don't have anything original to add or any original thought. I just heard Oksano say re-entry into the physical location or back into the building. And I thought, well, that works for me, re-entry. But it has a little different connotation than reopening, as if we've been closed for the last 2 months.
Good. I like that. Re-entry. I like it. Danny.
Yeah, I panicked a little bit when I saw that question originally, because I'm not sure what we call it. I mean, you're right, Greg. If we've been closed, we've been doing it wrong. I think we are just, putting the emphasis back on the excitement of a family being back together. We want to make sure that we are we're really focusing there. And I think if we do that, if we just view this as kind of a big family reunion, that's what it's going to feel like. That's what our community is going to see. And I think that's where the excitement will land for us. Good.
Thank you. Jason.
Yeah, the top three that I've heard in this order, reopen, re-entry, and then they've referenced like an in-person gathering. And so I don't know that I really have an opinion, because really that's all it is. I think I might have more of an opinion on the process to arrive at a word. And the process is this. If you study anthropology, the one thing that cultures have in common, they have their own language. And what I don't think churches should do, and you're not suggesting this, but I think churches could do this, because probably in the years past, I've done something like this. We try to get cute, or we try to come up with something. But I mean, a lot of the stores around here that I frequent, that our attendees frequent every day, they were closed, but they were also open online. So I think we have to make sure we're not assuming that people think of words like we think of words. And so if reopen is a culturally used word, and you don't have to explain it, it already is defined, they know what it means, and you could spend more effort on the plan and communicating the plan and crystallizing the plan, that's what I would do. I would spend less time on that word. And again, you want to get it just right. Does it mean that much? Probably not. And again, I'm not minimizing the word, because words are important. I totally get it. But I think you just got to, where do you want to put more of the weight? And if people use reopen because that's what society and culture is using and it makes sense, I don't have a problem using it, but I totally agree. And I get what you're saying. I don't like it. We never closed, but that's assuming people think the way that we do. We work in churches. We work with church people. So it probably matters more than I'm saying. I guess what I'm saying is I'm interested in the process, the thinking, the motive, the drive that lands me at the word I use more so than the word itself. I'm just going to focus on that process, use the word, but then I am going to really knock out of the ballpark our plan, because people can overlook a word or pay attention to your word all because of what your plan is. So if the plan isn't good, it doesn't make any sense. It's not helpful. So I think I don't know. That's just one dude's opinion in Atlanta.
That's a good word. I like it. I think you're absolutely right. I think you're absolutely right about that. So it is, I think our plan is important. That is all the questions I have. So I want to thank you guys all. The contact information's here on the screen, or it was. Now it's back. Contact information here. And I think as I was listening to this today, good information, but I think somebody said when this was said earlier, and I think this sums up as you're thinking about relaunching, reentry, reopening, whatever it is you're going to call it, whatever that is. I think two things to think about is how do you best care for and communicate with your folks? I think that sums up everything. If you're thinking first about caring for, right? If you're putting caring for your folks ahead of everything else, you're gonna come up with the right plan. If that rules the day, and caring for, if that rules the day, then you're gonna come up with a good plan, and then communicating that plan very well. If you think about caring for and communicating with, I think you got it. So guys, thank you so much. This was really good information, and I know those who watch this will get something out of it and be very appreciative of your time today, as I am. So thank you very much. And we're going to wrap it up now. And Jason and Danny and Greg, thank you again so much. I appreciate you spending some time here. And for those of you watching, thank you for being a part of this. And we will look forward to maybe talking again soon.